Harbor Health Services, Inc. is a nonprofit public health agency helping individuals achieve their full potential through access to local, affordable services that promote medical, dental, and behavioral health. Julie spoke to Ami Bowen, Director of Community Relations, about the programs and services Harbor Health offers in its 5 community health centers, one of them here in Plymouth.
Amy, it's so wonderful to have you join us today. Can you tell the audience a little bit about Harbor Health and what makes you different from a standard clinic or a standard hospital as a setting for healthcare?
Sure, and thank you so much for having us on Local Matters. We're really happy to be a part of this. So Harbor Health is a nonprofit public health agency. Our mission is to help people that achieve their full potential through access to local affordable services that promote good health. We operate 5 community health centers, including one here in Plymouth, and 2 programs of all-inclusive care for the elderly, and we serve communities from Greater Boston all the way down through Cape Cod. And what makes us different is that our community health centers, including our one here in Plymouth, are a federally qualified health center. And what that means is that we're able to offer a sliding fee scale and discounts for services based on family size and income. We don't want anything to stand in the way of somebody accessing healthcare that they need to stay healthy and be happy and safe in their community. So that's really what makes us different.
Now, let me ask you a couple things based on what you just said. So a lot of people have a health care plan either through their employer or through the exchange. Mm-hmm. And a lot of people don't have health care or they just can't afford it. What do you do for those people that don't have any insurance?
Well, we accept all insurances, including Health Safety Net and Mass Health. When someone comes in and they say, hey, I'm not sure if I qualify for health insurance, but I really need health care, we have folks that are trained in helping people work on what's called the Massachusetts Connector. We're really fortunate to live in a state that has really built that kind of insurance marketplace to make it as accessible as possible for people to get health insurance. It can be something that people need help navigating, and that's where we can come in. We can help you get health insurance. We can go over what your options are and then connect you to care. And that, we take all insurances so that somebody who comes in, asks for help with insurance, doesn't have to worry about, will you take my insurance?
Right. Where do I go now that you helped me?
Yes. Where do I go next?
Yeah.
And what's great is that we offer medical, behavioral health, and dental services. Dental services, sometimes you can run into issues where somebody doesn't take Mass Health, especially for adults, but we do. So we offer full access to dental services as well.
Now, the question comes to mind, why wouldn't everybody go to Harbor Health?
It's a great question. It's a great question. I think people have personal connections with their providers.
Yeah.
And, it's all about convenience, the connection that you have with your provider. If you've been with a provider for a long time, they know you.
Right.
One of the things that our providers focus on is family medicine. And that means they can work with somebody from the time that they are born to the time that they're working into their golden years. So it's in the biz, we call it continuity of care, but what we really try to do is establish that relationship, work with the whole family, work with the whole person. And, I think building that connection is an important part. And, we understand that some people have connections with their providers. We always want to make sure that we respect that. Mm-hmm. And then, but also offer them access if they're looking for a new provider, if they're new to the community, if they've had a change in insurance status so that perhaps their current provider doesn't take their insurance anymore. We have that perspective that we want to build that relationship with a patient.
Now, do you have a number of physicians and specialists right there on staff?
Yeah, we have 7 medical providers. We have 4 dentists. Ours is and we have behavioral health specialists. We also have a full care team. We have connections through telehealth to other types of specialists. And we also work with a variety of hospital partners and other networks to make sure if people need a specialist like cardiologist, for
Yep.
example, that we can connect them to that.
And
We really spec at primary care.
Okay,
So.
but so you will help people navigate that spider web of I need to go see a specialist, and the specialist sends me for labs, and how do I do it? And it's if you're not used to it, and you're not your own advocate, it can be daunting. And that's what when you say you serve the underserved population. Can you give me some examples of underserved populations, like especially here in Plymouth?
Yeah, so some examples would be lower moderate income individuals, individuals that don't necessarily have stable housing, individuals with really complex medical needs. Maybe they are in recovery, for example, and need access to medication for addiction treatment. There's a variety of populations that traditional healthcare systems know that and understand need some additional support in navigating the healthcare system, getting the care they need, getting the support they need, again, to live a healthy, safe, fulfilling life.
Right. Now you're a 501c3, so you're a nonprofit. How are you funded?
We rely on government grants.
Yep.
We also look for private funding opportunities. We rely on donations, but we do get reimbursed through insurance as well. So we have a model of care, just like any other private practice or hospital system, where we're reimbursed for services. But generally, medical care, healthcare, it has a lot of operating costs.
Yeah.
And so we look to offset some of those costs and be able to really stretch our resources as much as possible to serve our patients through the government funding, which allows us to offer that sliding fee scale through private foundations and private donations.
That's wonderful. Now, during this pandemic, the past year and a half, we're almost going on 2 years at this point, how has this affected the number of people that you're serving? And have you seen a huge uptick in the whole behavioral and mental health needs of your patients?
Yeah, like everybody else, we had to make that really quick shift, in March 2020, where we know we needed to be accessible to our patients, especially our patients who tend to live in multi-person households, rely on public transportation. Often we're doing frontline worker jobs. So we knew they needed access to care, especially as they were showing some symptoms of COVID. We were trying to balance that with the health and safety of our staff, maintaining the health and safety of our patients. So we luckily able, with some support from the state of Massachusetts, we're able to offer access to care through telehealth. We made that transition, which was very exciting for us. To make that transition, just having that additional way to reach and interact with our patients who often struggle because they're working multiple jobs or don't have reliable transportation, to be able to have an appointment through telehealth. So we've had to adjust that way and continue to try and engage our patients in care. But, it's like everybody else, we're trying to balance opening services, safety, getting patients in, understanding that patients maybe are hesitant to come in because we're still living under COVID. So it's definitely been a balancing act. We are definitely focused on trying to keep our patients engaged in care. Like everybody else has been talking about, so much was focused on COVID. Now we're trying to play catch up essentially and re-engage our patients in things like hypertension control, in for labs, diabetes control, really re-engaging them in that kind of medical care. As far as mental health, yeah, absolutely. I think we have a large recovery services program, especially in Plymouth, and I think that's where we had to try and be innovative and continue to have contact with patients and really figure out how to make sure they got the care they need, they got the mental health support that they needed, and all of our patients really need that extra support. So
especially now.
That increase, yeah.
And finally, what is your wish list for the future for Harbor Health?
Well, we have some really exciting community programs, which we've had this opportunity to expand as a result of the pandemic. I mean, really, I think we've all heard the statement, the pandemic has laid bare all these gaps and really shown how fragile the day-to-day existence of many people are, just knowing how close you are to needing to access a food pantry, for example. Just having those types of services available to folks is really critical. So I think one of our biggest areas of opportunity that we're really working hard within Plymouth is to make some of our community programs like our food pantry available. We now go every other week to Plymouth. People can you do not have to be a patient in order to access those services. And our food pantry really helps people get through the month.
Right.
We can connect them to SNAP benefits, which it helps provide supplemental nutrition assistance so that you can make sure you get food on the table throughout the month. We have a brand new sexual and reproductive health education services clinic called the Thrive Clinic that we are looking to bring to Plymouth and working with different community partners, welcome community partners. Sexual and reproductive health services is another kind of area during the pandemic that people just didn't have the same access to.
Right.
And trying to get them re-engaged, feeling comfortable asking questions in a free, confidential way, and then help them connect to care as much as possible. So those are two big areas that we're focused on.
Well, it sounds like Harbor Health does an awful lot.
Yeah. I mean, it's a really passionate group of people. We really care about the patients that we serve. I think that's one of the things I love about working there is that people really want the best for their patients and really help them get there.
Right. Clearly, your passion shows through 100%. Thank you so much, Amy. Really appreciate you being here today.
Yeah, thanks again for having us be a part of this.
Sure.
Thank you, Julie and Amy. To learn more about Harbor Health, visit hhsi.us.
If you've enjoyed this video by The Local Scene, please give it a thumbs up and hit the subscribe button. Thank you for watching.